Hello and welcome to the WHN Broadcast. I'm your host, Karen Ruby. Today we are joined by Dr. David Berger. And David, you've been talking about infections in healthcare. Do you want to tell us what's going on?
Yeah, sure. I mean, this really blows my mind that we are now tolerating what is effectively rampant infections of COVID and other respiratory viruses, but respiratory transmitted viruses in healthcare. So, as an example, there's been persistent data in the UK showing that at least 30% of COVID infections in patients in hospital were acquired by those patients in hospital. And this is very standard data that we see around the world. I was actually leaked some data here in Australia from Victoria, which showed a 10% death rate in 2022 from hospital acquired COVID infections. And subsequently, one of our newspapers here, The Age, did a Freedom of Information request. And again, we see that about 30%, at least 30% of patients in hospital with COVID infection acquired it in hospital. So we have a massive problem here of transmission of COVID. Along with other respiratory viruses, it's, from in past years when there was an influenza epidemic, we would see huge numbers of people contract it in hospitals. So this is a huge ignored problem.
This sounds terrible.
It is terrible. I mean, the analogy, which will be familiar to any healthcare worker, is with cannula site infection. When you have an intravenous cannula inserted for an IV infusion or IV antibiotics or whatever, then cannula site infection is always a risk. Usually with Staphylococcus aureus, it can lead to blood poisoning, can lead to infection of the heart. It's a serious thing. So we take lots of precautions against it. We try to limit the siting of cannulae for no more than 48 hours before they're rotated. And if a cannula site infection does occur, then anyone who's been on a hospital ward where that happens will know that it's a meltdown. You get kind of stern-faced managers walking around demanding to know how this has happened. There's usually some poor old junior nurse being bullied, for not having removed the cannula half an hour earlier. It's a major deal. And yet, for some odd reason, we are tolerating massive rates of infection in our hospitals with COVID. And we know, so the data from around the world, from Korea, from Australia, there's another good study, I can't remember where it is. They show a mortality rate, a death rate in hospital patients who acquire the infection in hospital of 10%. Now, in our tiny state of Victoria, which is a population of about 8 million people, we had at least 400 deaths last year from COVID acquired in hospital. So this is a huge problem. It's completely ignored, and it discriminates against people who are already in hospital with other illnesses and who are very vulnerable. It makes absolutely no sense to be ignoring it in the way that we are.
Yeah, it does seem like quite a high death rate compared to the general population who, for
Yeah.
COVID.
So if you compare the death rate of people in hospital with COVID who acquired it in the community to people in hospital with COVID who acquired it in hospital, it is higher. If you got last year in Victoria, if you got COVID in the community and ended up in hospital, you had just over a 7% death rate. If you acquired it in hospital, you had just over a 10% death rate. And it's not clear. Probably that relates to the fact that the people who are acquiring it in hospital are older and sicker. But it is huge. I mean, first of all, it's more than if you acquire it in the community. Secondly, hospitals should be safe. Whether you acquired COVID from a healthcare worker, another patient, a visitor, it doesn't matter. You would have thought that we would be providing a safe environment in hospital. And we're just not. There's this drive to remove any COVID mitigations. Smiles are back. Let's cut the ribbon of masks, and totally ignore that this is a problem. But we need clean air and proper infection control in hospitals.
Yeah, it seems quite wrong-headed at this point.
Very much so. I have to pinch myself every day when I look at what's happening, because I go, am I some kind of crazy conspiracy theorist? Is this just kind of completely nuts? And then you look at the data and you go, no, this is hard data. This is not fantastical. This is hard data replicated around the world, that we are in a situation where our hospitals are no longer safe. And that's really odd. I mean, if you go in to hospital for chemotherapy and you contract COVID, that's the last thing that you need. In fact, there was an abstract presented at an oncology conference this week that showed rapidly advancing that brain gliomas, so brain tumors, rapidly advancing in the 2 months after a COVID infection. So, and we're seeing more and more of these case reports. There was another case report recently of a cervical cancer rapidly advancing after a COVID infection. So, quite apart from all the other complications, this infection makes people's existing illnesses worse. So, why we take so much care in other aspects and we have this blind side about this is really, really odd.
Yeah. I mean, this feels extremely important. So thank you so much for being with us today. And for more information, you can go to our website, whn.global, and sign up to join us.